Have you ever stopped to think that something as simple as your bedtime routine might be quietly putting your life in danger? It might sound surprising, but the Centers for Disease Control and Prevention, CDC, reports that over 70,000 seniors pass away in their sleep every year in the U.S. alone. What's even more alarming is that many of these deaths aren't just due to aging. They're actually connected to avoidable nighttime habits that most people never question. As we age, our bodies become much more sensitive. After turning 60, your heart, brain, and lungs don't function as robustly as they used to. Sleep becomes lighter, muscles weaken, and things that once seemed harmless, like certain bedtime routines, can actually become dangerous. Unfortunately, many older adults stick to the same habits they've had for decades, unaware that these behaviors might be quietly harming their health or even shortening their lives. So what exactly are the hidden risks that could be hiding in your nightly rituals? Which common sleep behavior causes the most medical emergencies? And what simple adjustments can you make tonight to keep yourself and your loved ones safe? In this video, we'll uncover 7 sleep-related habits that have already contributed to the deaths of many seniors this year. Habit 2 is by far the most dangerous. Don't miss it. We'll also walk you through safe, practical steps you can take right away to sleep more soundly and safely. If this is your first time on our channel, welcome. We're here to help you live healthier, longer. Don't forget to like this video and subscribe Health B channel so you won't miss our future tips and insights. Your journey to better health starts now, and we're honored to be part of it. Also, let us know where you're watching from in the comments. We'd love to hear from you. Now, let's get into it. 7 dangerous sleep habits every senior should avoid. Habit 7. Drinking too much water. Before bed, let's start with a habit that seems harmless, even healthy: drinking water. Staying hydrated is essential for everyone, especially older adults. It helps regulate body temperature, supports digestion, cushions joints, and keeps your entire system running smoothly. But here's the surprising truth. Drinking too much water right before sleeping can actually lead to serious health issues, particularly as we age. As we grow older, our bodies become less efficient at managing fluids. The kidneys don't filter as effectively, and the bladder can't hold as much as it once did. On top of that, the urge to urinate becomes stronger and more frequent. So, if you drink a large glass of water, or even tea or juice, within an hour or two before bedtime, you're much more likely to wake up needing to go to the bathroom. Waking up once during the night might not seem like a big deal, but for seniors, getting out of bed in the dark can be risky. Nighttime bathroom trips are a major cause of falls in older adults. Think about it. You're groggy, the lights are off, your blood pressure drops as you get up, and your balance isn't what it used to be. All of this makes a short walk to the bathroom potentially dangerous. According to the CDC, falls are the leading cause of injury-related hospital stays among seniors, and many of them happen at night. But interrupted sleep comes with its own dangers too. Constantly waking to urinate keeps you from reaching the deep, restorative stages of sleep that your brain and body rely on to heal and function properly. Over time, poor sleep has been tied to memory loss, higher levels of inflammation, and increased risk for cognitive decline, including dementia and Alzheimer's disease. And that's not all. Sleep deprivation can also weaken your immune system and make chronic conditions like high blood pressure and diabetes harder to manage. There's also an often overlooked risk to your heart. Drinking too much before bed forces your body to work harder to remove the extra fluid, which can cause changes in blood pressure and strain your cardiovascular system. If you already have heart problems, this can potentially lead to irregular heart rhythms or even more severe complications. So how can you keep your body hydrated without increasing your risk at night? The answer lies in your timing and habits. Aim to drink water steadily throughout the day, but begin to cut back in the late afternoon. Avoid drinking large amounts of fluids at least 2 hours before going to sleep. If you feel thirsty closer to bedtime, just take a few small sips rather than finishing a full glass. Also, try to avoid drinks that act as diuretics, such as coffee, green or black tea, and certain fruit juices in the evening, since they'll likely make you urinate even more. And if you do need to get up during the night, make sure your way to the bathroom is safe. Keep the path clear, use nightlights or motion-activated lighting, and take your time when getting out of bed to allow your body to adjust. Making just a few simple changes to your evening routine can help you sleep more soundly, reduce your risk of nighttime injuries, and stay healthy, all without compromising on hydration. Habit 6. Eating late at night. Let's discuss a routine that often goes unnoticed but can have serious health consequences: eating late in the evening. For many, a bedtime snack feels like a comforting way to end the day. But for older adults, this habit can quietly trigger a series of health problems that extend far beyond occasional indigestion. As we age, our bodies process food less efficiently. Metabolism slows, digestion weakens, and the body becomes less effective at managing blood sugar and cholesterol levels. When you eat late, especially rich or heavy foods, your digestive system remains active when it should be resting. Instead of your body focusing on repair during sleep, it's busy working through the food you've just eaten. This can lead to disrupted sleep and added strain on internal organs, particularly the heart. One immediate concern is acid reflux. Lying down soon after a meal makes it easier for stomach acid to move up into the esophagus, causing a burning sensation in the chest. For seniors, this isn't just uncomfortable. Repeated reflux can lead to chronic inflammation, esophageal damage, and even a greater risk of aspiration pneumonia, where food particles or stomach acid accidentally enter the lungs during sleep. A study in the American Journal of Gastroenterology found that people who eat within 3 hours of bedtime are significantly more likely to experience nighttime reflux and related health issues. But it doesn't stop there. Late-night meals can also raise blood sugar levels, especially if they include sugary foods or refined carbohydrates. Aging bodies respond less effectively to insulin, the hormone that regulates blood sugar. This means nighttime eating can lead to elevated glucose levels that continue into the next morning. A 2020 study published in the Journal of Clinical Endocrinology Metabolism found that late evening eating was associated with higher blood sugar and insulin levels in older adults. Another concern is blood pressure. Normally, blood pressure drops during restful sleep, but eating late can interfere with this natural dip, leading to what's known as a non-dipping blood pressure pattern, something linked to an increased risk of heart attacks and strokes. In some cases, heavy meals before bed may also trigger irregular heartbeats, particularly in people with existing heart conditions. So how can you stay healthy without giving up food altogether in the evening? The most effective approach is to finish eating at least 3 hours before you go to bed. Stick to lighter meals at night, such as lean proteins, vegetables, and whole grains. Try to avoid fried, sugary, or heavy foods in the evening. If you do get hungry later on, choose something small and easy on the stomach, like a piece of fruit, plain yogurt, or a few nuts. Making these adjustments to your evening habits can lead to better sleep, reduced risk of acid reflux, more stable blood sugar levels, and better heart health. By giving your body time to rest and recover overnight, you're allowing it to function at its best, both now and in the long term. Habit 5. Sleeping in the wrong position. Most people have a go-to sleeping position that they rarely change, night after night. But what if that familiar position is silently harming your health, especially as you get older? For seniors, the way you sleep can have a significant impact on breathing, heart function, and even brain health. Let's begin with the position that poses the most risk: lying flat on your back, also called the supine position. Although it might seem comfortable, this way of sleeping can create serious problems for older adults. When you lie on your back, gravity causes the tongue and soft tissues in your throat to relax and fall backward, narrowing the airway. This is particularly dangerous for those who snore or have sleep apnea, but even people without a diagnosis can experience restricted airflow. According to the Mayo Clinic's sleep research team, sleeping on your back can worsen breathing issues by up to 40% compared to side sleeping. This reduced airflow has serious consequences. Interrupted breathing during sleep can lead to episodes of obstructive sleep apnea, where breathing stops and starts repeatedly throughout the night. Over time, these oxygen drops can contribute to brain damage, high blood pressure, and increase the chances of both stroke and heart attack. In fact, research published in the Journal of Clinical Sleep Medicine found that seniors who sleep on their backs face a 22% higher risk of nighttime heart events compared to those who sleep on their sides. There are other dangers too. For seniors dealing with acid reflux or hiatal hernias, sleeping flat on the back makes it easier for stomach acid to rise into the esophagus. This can cause silent reflux during the night, which may go unnoticed but still damages the esophagus over time. In severe cases, this can lead to aspiration when stomach contents enter the lungs, and may cause pneumonia or raise the risk of esophageal cancer. There's also a brain health concern. A study by Stony Brook University found that sleeping on your back decreases the brain's ability to clear out waste by up to 63% compared to side sleeping. This clearance process is essential because it helps remove proteins associated with Alzheimer's disease and other forms of dementia. When that system is impaired, harmful substances may build up more quickly, potentially speeding up cognitive decline. Sleeping on your right side isn't the best choice either, especially for individuals with heart conditions. That position can put added pressure on the heart's main blood vessels, possibly disrupting blood flow and increasing cardiovascular stress. So, what's considered the healthiest sleeping position? Most experts agree that sleeping on your left side is the safest and most beneficial. It helps improve circulation, supports digestion, reduces the chance of reflux, and enhances the brain's waste-clearing process, providing protection against neurological decline. If switching to your left side feels difficult, there are simple ways to make it easier. Placing a firm pillow between your knees can help maintain proper spinal alignment, while another pillow behind your back can keep you from rolling over during the night. An orthopedic pillow can also help support your neck comfortably. For those with reflux, slightly raising the head of your bed may also ease symptoms. Training yourself to sleep on your left side can lower your chances of nighttime breathing issues, heart complications, and cognitive decline. It's a small change with big benefits, helping you sleep better and wake up feeling stronger and more refreshed. Habit 4. Sleeping in a warm room. As we grow older, comfort during sleep becomes more important than ever. That's why many people instinctively turn up the thermostat, pile on thick blankets, or shut all the windows at night. But keeping your bedroom too warm could be quietly putting your health at risk, especially if you're a senior. In fact, maintaining an ideal sleeping temperature isn't just about feeling cozy. For older adults, it's a crucial factor for staying healthy and safe. Our bodies are programmed to cool down slightly as we fall asleep. This drop in core temperature plays a key role in signaling the brain that it's time to rest, helping us enter the deeper, more restorative phases of sleep. But when your room is too hot, typically above 70 degrees Celsius or 21 degrees, this natural process is interrupted. Instead of easing into sleep, your body has to work harder to release excess heat, which can result in restless nights, frequent waking, and grogginess the next morning. For seniors, the impact of sleeping in a hot room is even more concerning. As we age, the body's ability to regulate internal temperature weakens, making it more difficult to cope with overheating. A study published in the American Journal of Geriatric Psychiatry found that older adults sleeping in rooms above 70 degrees experienced up to 30% less deep sleep, known as slow-wave sleep. This stage of sleep is essential for memory consolidation, immune system strength, and cellular repair. Missing out on it can lead to a cascade of health problems. Consistently poor sleep caused by a warm environment has been linked to increased inflammation, elevated blood pressure, and a reduced ability to fight infections. Over time, these issues can raise the risk of heart disease, type 2 diabetes, and cognitive decline. The same research also noted that sleep disruptions due to heat may speed up age-related memory loss and impair the body's natural defenses. Another serious concern is dehydration. Seniors often have a diminished sense of thirst, and sleeping in a hot room can cause sweating that leads to fluid and electrolyte loss. This not only dehydrates the body, but can also make the blood thicker, increasing the likelihood of blood clots, heart rhythm problems, and even stroke. For individuals with heart or lung conditions, the added strain of trying to cool down overnight can cause dangerous complications such as breathing issues or cardiac events. So, what is the best bedroom temperature to support healthy sleep? Experts suggest keeping your room between 60 degrees and 67 degrees, around 15 degrees to 19 degrees. To maintain this range, use lightweight and breathable bedding. Cotton sheets work well, and avoid thick comforters or heated blankets that trap warmth. If you feel chilly, layer your blankets so you can easily remove one during the night. You might also consider using a fan or cracking open a window slightly to promote airflow and keep the room comfortable. Making small changes to your sleeping environment can have a powerful effect on your health. By keeping your bedroom cool, you're helping your body rest properly, protect your heart, support brain function, and improve overall well-being. A cooler room isn't just a preference, it's an important part of healthy aging. Habit 3. Standing up too quickly after waking. Have you ever gotten out of bed during the night or early morning, then you feel dizzy, unsteady, or like the room was spinning? If so, you're definitely not alone, and what you felt was not in your head. For older adults, getting out of bed too fast can be a surprisingly dangerous habit, responsible for a large number of falls, injuries, and emergency room visits every year. The underlying issue is known as orthostatic hypotension, also called postural hypotension. This condition refers to a sudden drop in blood pressure when a person moves quickly from lying down to standing up. As we age, the body's ability to regulate blood pressure and blood flow becomes less effective. So when you rise too fast, blood can temporarily pool in your lower body. This means your brain may not receive enough oxygen-rich blood right away, causing symptoms like lightheadedness, blurred vision, or even fainting. This isn't just a mild inconvenience, it's a serious safety concern. A study published in JAMA Internal Medicine found that older adults with orthostatic hypotension face a much higher risk of falls, bone fractures, and even death. Falls, in fact, are the #1 cause of injury-related hospital admissions for seniors, and many of these accidents occur during the night or early morning hours when blood pressure is already at its lowest and the body is transitioning out of rest mode. The effects of a fall can be life-altering. Hip fractures, head trauma, and broken wrists are common results, often requiring long recovery periods. In some cases, one fall is enough to cause a loss of mobility or independence, extended hospitalization, or complications that seriously impact long-term health. Because of this, it's essential to take precautions, especially during your nightly or early morning routine. Fortunately, small adjustments can sometimes make a big difference in reducing the risk. When you wake up, avoid jumping out of bed right away. Start by sitting up slowly and giving your body a chance to adjust. Take a few moments to move your toes and rotate your ankles to stimulate circulation. Inhale deeply a few times, which also helps stabilize your blood flow before standing. Keep a glass of water on your nightstand and consider sipping it before getting up, particularly if you tend to be dehydrated. Dehydration can make drops in blood pressure worse. Make sure your route to the bathroom or kitchen is free of obstacles and is well lit. Night lights or motion sensor lights are useful for preventing accidents in the dark. If needed, hold on to something stable, like a dresser or handrail, when you stand up. Also, avoid walking in slippery socks or on unsecured rugs. Wear slippers with non-slip soles and make sure the floor around your bed is clear of clutter. Lastly, if you take medications that affect blood pressure, it's worth speaking with your doctor about whether any adjustments are needed, either in dosage or timing. By being mindful of how you get out of bed and taking a little extra time in the morning or during the night, you can significantly lower your risk of falling and protect both your health and your independence. Moving slowly and intentionally isn't just about comfort, it's a simple but powerful step towards staying safe every day. Habit 2. Overlooking snoring, breathing pauses, and insomnia. Snoring is often treated as nothing more than a minor annoyance, especially as we age. But that nighttime noise, or the quiet moments where breathing stops, may be warning signs of a far more serious issue. For older adults, ignoring symptoms like snoring, interrupted breathing, or ongoing sleep difficulties can quietly increase the risk of dangerous, even life-threatening health conditions. One of the most overlooked yet serious sleep disorders affecting seniors is obstructive sleep apnea. This condition happens when the muscles at the back of the throat relax excessively during sleep, causing the airway to narrow or collapse. When that happens, breathing may stop for several seconds at a time, sometimes hundreds of times throughout the night. Each of these episodes lowers oxygen levels in the blood, forcing the heart to work harder to keep the body supplied with what it needs. Over time, this constant strain can lead to serious cardiovascular issues, including high blood pressure, irregular heart rhythms, and a dramatically increased risk of heart attacks and strokes. The statistics are concerning. Findings from the Sleep Heart Health Study show that untreated sleep apnea raises the risk of fatal heart attacks by 30% and strokes by as much as 60% in older adults. Even more alarming is how widespread the condition is. Nearly 40% of seniors may be living with sleep apnea, yet around 80% of these cases are never diagnosed. Many people don't recognize that their snoring or restless nights are symptoms of a medical problem, not just age-related sleep changes. But the effects extend beyond heart health. Sleep apnea disrupts the deep stages of rest that the brain needs to repair and perform well. Lack of this restorative sleep can lead to memory lapses, mental fog, and an increased rate of cognitive decline. In fact, studies have shown that older adults with untreated moderate to severe sleep apnea experience brain shrinkage in areas tied to memory and decision-making nearly 3 times faster than normal age-related decline. How can you tell if you might be affected? Often it's a spouse or family member who first notices the signs: loud and persistent snoring, long pauses in breathing, gasping or choking during sleep, or frequent nighttime awakenings. Other indicators include waking up with a headache or dry mouth, feeling exhausted throughout the day, or struggling to stay awake during quiet activities like reading or watching television. Chronic insomnia, or difficulty falling or staying asleep, may also point to an underlying health issue. While the occasional sleepless night is common, long-term insomnia may signal heart, brain, or hormonal imbalances. It can also compromise immune function and worsen stress, making it harder to manage conditions such as diabetes and hypertension. If any of these signs sound familiar, it's important not to brush them off. Speak with your doctor or consult a sleep specialist. Effective treatments are available, including CPAP therapy, weight loss strategies, and lifestyle adjustments. Research has shown that treating sleep apnea can cut cardiovascular risk by up to 42% in older adults. Ultimately, snoring and sleep disturbances shouldn't be dismissed as just part of getting older. They're your body's way of alerting you to potential trouble. By recognizing the warning signs and getting help, you're taking steps to protect not only your heart and brain, but also your overall quality of life. Habit 1. Taking the wrong medications. Before bed. For many older adults, taking medication before sleep is just part of the nightly routine, whether it's a pill to ease joint pain, lower blood pressure, or help you fall asleep. These habits can seem harmless, just another step in winding down at the end of the day. But the reality is that some medications taken at night can pose serious health risks, especially as we age. Let's start with sleep aids and sedatives, which are commonly prescribed to treat insomnia or anxiety. Drugs such as benzodiazepines, including diazepam, clonazepam, and alprazolam, slow down activity in the central nervous system to promote relaxation and sleep. However, they also suppress breathing and reduce alertness, which can be dangerous for seniors, especially those with heart or lung conditions. According to research published in the British Medical Journal, older adults who regularly take benzodiazepines face a much higher risk of falls, fractures, and even death compared to those who avoid these medications. The effects of these drugs can linger into the morning, leading to grogginess, confusion, and poor balance, all of which significantly increase the risk of nighttime accidents. But it's not just sleeping pills that raise concern. Certain antidepressants and muscle relaxants, often taken before bed, can interfere with deep sleep, the stage that plays a key role in maintaining memory and brain health. Over time, poor quality sleep can contribute to mental fog, memory loss, and even speed up cognitive decline. Painkillers, especially non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and diclofenac, can also become problematic when used frequently. These medications place additional strain on the liver and kidneys, reducing their ability to process and remove toxins. When taken in combination with other prescriptions, they can also increase the risk of internal bleeding, particularly in older adults. Blood pressure medications are another area of concern. While some individuals benefit from taking these drugs at night, others may experience a dangerous drop in blood pressure during sleep, limiting blood flow to the brain. This can result in dizziness, fainting, and even increase the risk of stroke. A study in the journal Hypertension showed that the timing of blood pressure medication can significantly affect overnight blood pressure patterns and long-term cardiovascular health. In addition, drug interactions become more hazardous with age. As the body slows down in processing medications, one drug may unintentionally amplify the side effects of another. Combining sedatives, painkillers, or blood pressure medications without medical supervision can lead to serious, even life-threatening complications. So, what can you do to stay safe while managing your health? The most important step is to consult with your doctor or pharmacist before making any changes to your medication routine. Ask whether safer alternatives are available, especially if you've noticed symptoms like drowsiness, confusion, or balance issues. Where possible, consider non-drug options for sleep, such as relaxation techniques or herbal teas. If you're taking blood pressure medication at night, monitor your readings regularly and share any unusual changes with your healthcare provider. And if you're using multiple medications, review your full list with a medical professional to make sure the combination is safe. Making small adjustments to your medication routine can dramatically reduce your risk of nighttime falls, improve your sleep quality, and help protect your long-term health. Even subtle changes can have a powerful impact on how you feel and function each day. As we close out this series, one message is clear. Even minor adjustments to your nighttime habits can lead to major improvements in safety and well-being. Whether it's changing how you take medications, keeping your room cool, or avoiding large meals before bed, each positive step brings you closer to better health. Have you ever unknowingly made one of these sleep mistakes? Or do you have a personal tip that's helped improve your sleep and safety? Feel free to share your experience. We'd love to hear your story and learn from your insights. And if you found this guide helpful, consider following HealthBee channel for more content on how to live a longer, healthier life. Thank you for watching.